What is the true cost of a dental implant? Everybody asks. I'm here to address that. Honestly, it will depend on each individual patient. I know. You just want to hear some numbers. I'll try to give some ranges. So here are the numbers. Do you have a tooth to be extracted or teeth to be extracted before your dental implant? The cost of that will be anywhere between $300 and $500 US, depending on the difficulty of the extraction. The actual dental implant will cost you anywhere between $2,300 to $2,500 US. If your surgeon is using a guide, I do, that will be anywhere between $500 to $1,000 to $2,000, depending on the implant types we are placing. Are we doing a single implant? Are we doing multiple implants? Are we doing a fixed prosthesis case for a full mouth rehabilitation? Following your dental implant, do you need bone to be grafted before or after or during the placement? Are you going to have this procedure under local anesthesia or sedation, IV sedation, where you're fully asleep? My experience is if I'm doing more than 3, 4, 5 implants, most of these patients want to be asleep. How much is the anesthesia? Well, it depends. Is the procedure 30 minutes, 45 minutes, or 2 hours? I can tell you the average will be anywhere between $1,000 and $2,000. What about other adjunctive procedures? Do you need any soft tissue augmentation, tissue grafting? Do you need the use of PRIF? Do you need any use of specialized instruments? There would be a range. What about fixed cases? That's what I do the most. Someone comes in that they want all of their teeth out, or probably all their teeth are out, and now they have to get 5 or 6 implants per arch. That's what I like to do. Some do only 4. I believe in 5 to 6. There would also be a range depending on the material that are used to fabricate your teeth. Starting with the highest end, 5 to 6 implants per arch with final fixed zirconia teeth. The range will be anywhere between $30,000 to $40,000 per arch, depending on whether you had teeth or not, whether you needed extractions or not, whether you had enough bone to place 4, 5, 6 implants or not, and all the associated adjunctive procedures. So if you want to assume the worst, that would be $40,000 per arch from the beginning to the end. That would include all of your surgical fees and the actual final teeth being placed. Could it be cheaper? Of course. I'm hoping that this video addresses some of the questions that most people will be asking themselves before they go see a dentist. So if you're coming in for a single extraction with a single implant, you do the math. If you're coming in for a full mouth rehabilitation, you do the math. But I want to put it into perspective. It's not about the money. It's about the value of the service that you're getting. Come in for a consultation. That's where to start. So this way, we can provide you with a customized treatment plan broken down for you. And based on that, then we can talk about how do you want to address finances. Do you want to pay all of it up front? Do you want to go into a payment plan? So I figure I'll make this video to sort of answer some of these questions and put it into perspective. We have several financing options, and we know, and we'll pick one that works best for you. My goal is to give you a plan. That would be what I'll provide for myself or a close family member. And at the end of the day, you make the final decision. I hope to see you soon.